Hey, Deanna.
Hey,
How you doing today?
good, how are you?
I'm good. Are you working on the Miss Falls Alive case?
Yes, I am. They just checked in. Why?
Good. I was just reviewing her chart and noticed that she doesn't have an advanced directive on file.
Oh, okay.
Perhaps maybe when you're talking to her, you could work with her to create one?
Recent studies have shown that 89% of patients and their families would like to discuss advanced directives with their primary care physician. While a majority of PCPs agree that these discussions are imperative to have, only 75% agree that it's their responsibility to initiate planning. As a result, only 18 to 39% of the adult population have completed advanced directives.
Absolutely. I'll make sure to do that with them today. Thank
Perfect.
you.
Thanks, Deanna.
After her assessment, Deanna is ready to speak with Ms. Falslot and her granddaughter, Monica, about advanced directives.
Miss Falsalot, do you know what advanced directives are? I was looking at your chart and I didn't see one.
No, I don't. Well, we tried to talk about them over Thanksgiving break, Grandma, but we didn't know what questions to be asking, and you didn't seem really ready to talk about it. But Deanna, because she had a fall that she was hospitalized for in September, and she lives alone, we're worried about her.
Absolutely. So I'm so glad to hear that you all have started this conversation. What I want to do now is just take some time to go over what an advanced directive is. So here, if you want to go ahead and look over it, an advanced directive is essentially a legal document which tells what you would like to be done in an incident where you were unable to speak for yourself. Think of it as a written form of your medical wishes. Family members and medical personnel use this document to ensure that they're providing medical care to respect those wishes. The main topic of discussion is whether or not you would like life-sustaining measures if something does happen to you. For example, if your heart stops, would you want them to perform CPR?
No, I wouldn't like that. I'm old. When my time's up, my time's up.
Okay, sounds good. Sounds like you would like what's called DNR, which is do not resuscitate, which means that you don't want CPR to be done in the event that your heart stops. We encourage you all to take the time to think things over and talk about it with your family because this is a legal document. And it can be very difficult to talk about these things, but it is very important. Having an advanced directive means that you have made some of the tough decisions before an emergency occurs and it's too late.
Thank you so much for going over this with us.
Thank you. Absolutely.
Notice how Deanna stopped and took the time to explain what advanced directives are and why they are important? She organized the patient's priorities by creating SMART goals and was able to provide clarity to the patient and her granddaughter. Maryland Advanced Directives consists of 3 parts. Part 1 details the patient's primary and backup healthcare agent. Part 2 details the patient's treatment preferences, similar to that of a living will. Patients have the options of completing Part 1 and Part 2, or only Part 1 or only Part 2. Part 3 consists of signatures and witnesses. And finally, after my death is an optional addition to the advanced directive. During advanced directive planning, it is important to explain the various parts, encourage family input and discussion, and ensure the patient is comfortable.